Mushroom poisoning. Fatal poisoning often results when adventurous cooks fail to distinguish poisonous mushrooms from non-poisonous varieties. Amanita phalloides, also known as the death cap, is a species of mushroom that is especially toxic. Within 24 hours, the toxins from this mushroom will often cause irreversible damage to the heart, liver, and kidneys. Ingestion of as little as 1/4 mushroom cap, approximately 2/3 of an ounce, usually results in death. Short-term survivors often suffer enough liver damage that they require a liver transplant to achieve long-term survival. In the 1950s, a French physician by the name of Bastian developed a successful vitamin C treatment protocol for mushroom poisoning. The method consisted of giving intravenous vitamin C along with a couple of antibiotics for 3 days. By 1969, he had successfully treated 15 patients for poisoning. He was so convinced of the efficacy of his protocol that he publicly consumed what would have easily been a fatal dose of mushrooms, about 2.5 ounces, and then successfully treated his own poisoning. And not just once, but twice. It should also be noted that there are no examples in the literature of an antibiotic effectively neutralizing a deadly toxin. Therefore, it is highly unlikely the 2 antibiotics Bastian used played any significant role in the recovery of the patients he treated. It's much more likely that vitamin C did the job alone. For a time, Dr. Bastian's method became the treatment of choice at a number of medical centers in France. Then the protocol fell into obscurity until it was rediscovered in 1984, resurrected, published, and added to the dusty stacks of unread medical literature. We'll never know how many mushroom poisoning victims have left this world writhing in pain because emergency physicians were, and continue to be, ignorant of vitamin C. How wonderful it would be for the ultimate antidote to be available to all who may need it in the future. Thankfully, however, statistics show that the vast majority of people will never be victims of an acute, potentially fatal poisoning crisis. Fortunately, most of us will never experience a venomous snake bite, a barbiturate overdose, being sprayed with pesticide, eating a poisonous mushroom. We all face a much different challenge, a very slow, minute by minute, microgram by microgram poisoning from an array of other sources. The daily need for the ultimate antidote. Much is made of the toxicity of our modern world. Frequently we're told that still another substance in our surroundings has been leaked to cancer, heart disease, Alzheimer's disease, or some other degenerative malady. There's mercury in your tuna, pesticides in your lettuce, hormones and antibiotics in your chicken, PCBs in your water, poisonous exhaust in the air you breathe, cancer-causing UV light from the sun, and toxic chemicals, all with names that are too long to pronounce, in your clothes, your carpet, your car, your shampoo, your deodorant. Vitamin C has the proven ability to neutralize virtually any toxic substance and even the dangerous effects of radiation. Arguably, it's the safest substance on the planet. Therefore, it makes perfect sense that copious vitamin C supplementation should be part of everyone's defense against the daily onslaught of environmental toxins. It's not complicated. Credible science proves a direct correlation between vitamin C blood levels and mortality rates. Data from large population studies indicate that mortality rates could be cut in half from all causes if people substantially increase their blood levels of vitamin C. But rather than follow the science, our government, with the backing of the medical establishment, pushes a totally unfounded mantra. The average dietary intake provides 100% of our requirement for vitamin C, and much more just creates expensive urine. Think about it. The amount of water needed to put out a fire depends on the size of the blaze. In a house fire, the firemen furiously pump water on the inferno until the flames subside, and then a lot more for good measure to quench the remaining heat. To simply toss one bucket on a fire, regardless of size, and then to suggest that using any more will just create expensive steam is maliciously reckless. Just as firemen use as much water as is necessary to extinguish a fire, vitamin C pioneer Dr. Klenner continued to administer vitamin C until he obtained the desired clinical response. And then he typically continued high dose vitamin C for several more days to assure there was no relapse. As his legacy demonstrates, it's a safe, reasonable, and life saving strategy as long as you give enough of it for a long enough time. Conclusion. Consider the facts. Determining the type or quantity of an offending poison or venom is not always possible. Locating a traditionally approved antivenin or antidote for a specific toxin can exhaust invaluable treatment time. Many antivenins and antidotes have their own significant toxicity. All humans are subjected to a daily barrage of toxic substances linked to the development of cancer, organ diseases, and aging diseases of the brain. Vitamin C has clearly neutralized a host of otherwise fatal toxins and venoms. See Resource H. High blood levels of vitamin C lowers mortality from all causes. Vitamin C has no unhealthy side effects. See Chapter 7. Vitamin C has no known toxicity. See Chapter 7. There is no downside in giving vitamin C before even evaluating the patient, as Dr. Klenner often did. A change in the way healthcare institutions treat patients is long overdue. The needed change will not be initiated by drug companies, politicians, government bureaucrats, medical schools, insurance companies, hospital administrators, or mainstream medical practitioners. So don't look for a wide acceptance of vitamin C therapies in traditional emergency treatment centers in the near future. More about this is discussed in Chapter 7 and 8. Until then, personal vitamin C supplementation is more than an option. It's an opportunity that will pay huge dividends. Even if you never fall prey to an infectious disease and are never accidentally exposed to a life-threatening toxin or venom, there are many compelling reasons to add several grams of vitamin C to your daily intake. In fact, the most compelling facts, benefits, and reasons are ahead.